Hey everybody, it's Dr. Bree, the physical therapist, and we are your favorite senior care specialist. So earlier today, I did a 30-minute walk and talk that was live on Facebook, and I want to just expand upon that. So what I talked about was October, November, December tend to be some of the busiest months for orthopedic surgeries. And when I mean orthopedic surgery, I'm talking like a knee replacement, a hip replacement, back surgery, shoulder, like rotator cuff surgery, total shoulder, ankle, really anything like that. And that happens because typically by the end of the year, you've used up most of your deductible. So then you're not going to have some big giant out of pocket cost to have that surgery completed. And what I talked about was the different ways that you can prepare so that when your surgery happens, your recovery is going to be better. You're going to reduce your risk of falls, reduce the risk of infection, to just ensure that you get recovered in a shorter period of time without complications. Because I think a lot of times, and especially like my last live walk and talk, I discussed a client, a friend of Lynn's, my assistant, that is in her early 80s, had a knee replacement done, and the doctor's office told her, like her, I believe it was the ortho, don't quote me here, I'm not 100% sure, but it said, hey, don't worry, you're going to end up in rehab for 2 weeks, you're going to be fine. She spent one night in the hospital and then went home. So nothing was set up. She was not ready. Lives in a 2-story home, bed and bath on second floor, didn't have equipment. And by the way, only got 3 visits of home care and then was expected to go to outpatient, which, by the way, you can't drive for 2 weeks post-surgery, plus you can't drive on pain meds. Didn't have family really close by. So let's make sure that that is not the same thing that happens to you. So what I always tell people, pre-surgery, like 2 months prior, one of the biggest things I would have you start doing, look at your diet and start making dietary changes. Okay, what can we start getting rid of in our diet that is inflammatory? So start cutting out the processed foods, try and cut out the carbs, the sugary drinks, increase your water intake, increase your protein. Because what do you need to help your skin heal, your muscle heal, your body just be less inflamed? High protein, higher fat, like animal fat, low carbohydrate, low sugar. So what's that also going to mean? That's going to be you're going to be less swollen, you're going to have less pain, the healing process is going to be faster. Win-win. And hey, maybe your pain's going to be even lower prior to surgery. So speed everything up. Then the next thing that I would tell you to do is, a lot of times, like if you're having a knee done, I'm not sure if they still do this with hips, but they'll do prehab. But a lot of times too, you're getting therapy prior to this because obviously you're trying to fix whatever the issue is that you're having the surgery for. But find out what your exercises are going to be post-surgery and start working on those exercises. Because the stronger you are, the more mobile you are going into the surgery, the better off you're going to be. And hey, again, that just means it's going to be easier for you to recover. We're going to be stronger in that area. Win-win. And if you can't get therapy out to the house right away, boom, you already know what you should be doing. Wahoo. Then the next thing I would tell you to do is get your house ready. And that's why I offer a one-time home assessment. So I will actually come to the house. I will go room by room. Like, people actually FaceTime me. And we can go through the house and I'll tell you what you should move, what you should get to help set yourself up to be successful. So, for example, pick up the rugs, remove any clutter in the home. Like if you have extension cords, if you have a bunch of knickknacks on the floor, try and get those out of the way. If you have a coffee table that's going to be in the way of the couch or your primary sitting surface, get that out of there, because you want to be able to use your cane, your wheelchair, your walker safely and not get stuck on stuff. If your couch is your primary support surface or you have a recliner and it's going to be too low, what you can do is you can actually put like a piece of wood under the seat cushions to help firm it up so there's less of a sag. That's one thing. The other thing you can do are actually get furniture risers to help raise the couch up. There's different heights you can get them. For the recliner, they make something called a recliner box. And essentially, it's like a 2x4 box. You sit the recliner in, so it's raising you up. It was like 2 inches. Well, I think it's a little less than 2 inches, but you can do that. Something else you can also do too is put like a piece of 2x4, or I've even had clients use like garden bricks right underneath the front of the recliner. So a lot of times those recliners tip forward, and then that means it's going down those additional 2 inches if you don't have the brick there. But if you do, it stays up a little higher, easier to get up from. So obviously, the higher the support surface, the easier it is to get up. So that's something simple you can do there. If you go into your kitchen, what I always recommend is putting your frequently used items, like the things that you're going to need after surgery, on the countertop. Remove the stuff that you don't need. And in your actual refrigerator, try and put all those things that you're going to be, like your water, your fruits, your vegetable, whatever, your food, like shoulder to hip height. Have it right there so it's easy access. You're not going to strain yourself, less likely to fall getting in there. Something else I would do too is prep yourself with some freezer meals. So like if you have like crock pot meals, or you have stuff that's frozen that you can just put in the oven and go, awesome. Set yourself up for a couple weeks of that stuff. It'll be great. Thing two, like get a click list for the grocery store so you can get and see even about getting it delivered if you need to. So now if we go to your bedroom, same thing with removing clutter. Try and push that bed over to the side if you need to. Remove a nightstand if you need to. If you have rugs, again, pick those rugs up. If you need lighting at night, put a night light in there so you can see. I do typically recommend getting a bed cane, or it's like a short bed rail, goes between your box spring and your mattress. Awesome, especially if you're going to be on pain pills, you're a little woozy, getting up in the middle of the night, and get a little dizzy. Gives you something to grab a hold of. If you have a back surgery, it's also really helpful with getting in and out of bed. And then as far as the bathroom goes, depending upon what your bathroom setup is, I would typically recommend, like if you have a shower, get a shower chair and try and get one that has a back on it and arms. It's just going to make it a whole lot easier to get up, especially if you're having pain or you're feeling lightheaded. Those little shower stools are super dicey sometimes. They don't have handles. It's just a stool. It's like, be careful. Non-slip strips in the shower also work great. Handheld shower head, which allows you to be able to sit and do the shower. A long-handled scrubber, a dressing stick, reacher, a long-handled shoehorn. All of that stuff is super helpful. You can get a toilet riser for the toilet. So obviously, the higher the toilet, the easier it is to get up. And especially if you're having a hip replacement, depending upon what the approach is and what your restrictions are, you typically are not able to bend past 90 degrees at the hip. They don't want a lot of internal rotation, external rotation, extension. So we're trying to keep that leg pretty neutral. So you can get a toilet riser that attaches to the bowl. Something else you could actually do is you can order 2 bedside commodes. Like you could get one for your bedroom if you need it, or you can order a bedside commode and you can actually pull the bucket out of it, and then it makes something called a splash guard. But then that way you have a seat to sit on, and then you have a set of handles to be able to get up and down from the toilet with. Makes your life about 10 times easier getting up. And if you have bath mats in the bathroom, pick them up. You only use them when you're getting in and out of the shower. I get it. You don't like cold feet. Too bad. Just it's a giant tripping hazard. So yeah, doing that and having all those things in place, super, super helpful. If you have steps and you're going to be non-weight bearing for a period of time, I would look into a ramp. They even will rent stair lifts. They also will rent lift chairs. So, and they make portable ramps. So, they're called suitcase ramps. Now, depending upon how many steps you have to get in and out of the house or in the house, that might not be feasible. It does work sometimes if you've got like 3 or 4 steps and you need to use a walker, or you can't even get up the steps. So you can look into that suitcase ramp or look at renting a stair lift. Some companies do that. So now let's say you're back home, you're not going to rehab, you're going to be waiting on home care to come out and see you. So this is where having all these pieces of equipment in place is so important. Because I'm telling you, when you're on your pain medications, you are not the same person. Your memory is not the same. Your balance is not the same. Not to mention, we're having severe pain, swelling. You're recovering not only from you have like the trauma from the surgery, you also have just the trauma that's been built up with that degeneration of that area. You got a lot of things going on. And actually, too, something I forgot to mention, get a pill box. If you're somebody who does not typically take a bunch of meds, I'm telling you, you're going to be on pain meds, sort those suckers and put them in a pill box. I even know for myself, when you're feeling like crap and your memory is not great, you don't remember the last time you took it. And the last thing you want to do is like double up on a blood pressure med and boom, we're super dizzy, lightheaded, falling. We damage the hardware. Oh, guess what? Now we're back in for another surgery and even more therapy. Oh, and our recovery time might be doubled in length. Yeah, don't do that. Don't do that. And so you would have had your exercises. You already know what your exercises are. And so even if therapy's late to get out to see you, you already know what you should be doing. You already have a plan in place. If you are told to wear compression stockings, wear the compression stockings, guys, okay? Because not only is that going to help prevent a clot, but it's going to keep the swelling out of your legs, because we want to ensure that you maintain that skin integrity. Because what can happen when you get a bunch of swelling in that area, the skin just swells and then it can get porous. So literally it opens your body up for infection. So like you scrape it against something, boom, we can get cellulitis, which is an infection in your skin. It's the last thing you want to be dealing with. So wear the compression hose. And the other thing too is the less swelling we have in that area, the better it's going to heal. Okay? Wear the compression hose. Secondly, I'm talking about the exercises. You also want to make sure that you keep moving. Okay? Because you've had your surgery, a lot of people are like, oh, I need to sleep and recover. No, you need to move. You need to move. Because the more you keep moving, now I'm not talking like we need to go out and walk a marathon, but we need to not be just laying on the couch or laying in bed all day long, because we need to get up and move. We need those muscles to help push that fluid through our system. Those muscles work like a pump, help us get that good oxygenated blood flowing, helps facilitate healing. Not to mention, too, when we move, we are releasing hormones to help with healing, to help with pain, okay? And when we're on those pain pills, what does that do? Constipation, okay? So you need to get up and move to help with your digestion, all right? Because just the act of moving, the act of just getting up, the stomach muscles are contracting. That's going to help. Gravity is going to help with digestion, all of those things. And then on top of that, you need to make sure that you're drinking enough water. So the more hydrated you are, obviously the more you're going to have to go to the bathroom, but that means the better your flexibility, the better those muscles can move, the better your joints can move. And we need to be drinking that water to flush everything out of our system. So you've just been under anesthesia, you've just gone through the surgery, you have a bunch of meds in your system. What do we need to ensure? We need to ensure we're flushing all of that out. And a lot of times what we would see is because people are in pain, they're not drinking water, they don't want to be getting up. This can also lead to urinary tract infections, dehydration, kidney failure. No, you do not need to get into that, okay? The other thing you want to think about too is if you are cleared for showering, what you want to make sure you're doing, and a lot of times you'll have like a Tegaderm or like one of those clear bandages on there that are waterproof. And now obviously every doctor is going to be different on what their recommendations are, but FYI, you have a wound, you don't want to submerge it. That can cause an infection. But a lot of times they'll let you shower and let the water run off of it depending upon what stage you're in. But again, get cleared by your doctor with what they allow you to do. So when you are cleared to take the shower, what I want you guys to think about is if you're washing your body with a loofah or like a washcloth or whatever, don't wash your whole body and then go over here and wash around the wound, okay? And the reason for that is because our skin naturally grows bacteria on it, okay? So you want to take a nice clean washcloth and wash around that wound area, because we don't want to be spreading any bacteria near that wound area that could potentially go in, and boom, we get a big old infection. No, 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 no. And then going off of the infection, always watch for abnormal swelling, redness, drainage, abnormal smells, okay? So really watch that. If you start to see more fluid coming out, it's starting to get painful, it's starting to swell more, and there's really no reason for this happening, get on the phone and call your doctor. You want to get on top of that ASAP. And like when I was talking about those compression stockings, you also want to make sure that you're getting your feet elevated, all right? So if we're sitting and we're just sitting in a chair with our feet on the ground, what's gravity doing? It's just pulling all of that fluid towards the ground. You need to keep your feet up. All right. Not only is that going to help reduce the risk of a blood clot, but it's just also easier on your system. It's easier for everything to circulate. It's easier for everything to heal. Okay. So keep those feet up. It's going to help keep the swelling down. And like I said, that will help promote the healing process. And again, stay on that low inflammation diet. You need that protein to help rebuild everything. Protein will help with the skin integrity, muscle building, all of that stuff. And lower inflammation means what? Less pain, quicker healing. And then now, let's say therapy starts. Something you guys want to think about. Make sure that you are always dressed and ready to go when the therapist is going to be there, okay? And ensure that you've had your pain meds at least 30 minutes to an hour prior to you starting the session. That way, you're going to be ready to roll and you're going to be able to get the most out of your session. And I always tell everybody, when the therapist comes out, if there are specific things that you feel like you need to work on or you have questions over, make sure you write it out and talk to them about it. And just know, like that home care therapist that's coming to see you, their goal is to get you discharged to outpatient, all right? And you may only have 3 visits. So you are going to be the one that's in charge of your exercising. So don't just be depending upon this therapist to do this for you. You need to be in control here. They're going to be coming out to work on those things that are a little challenging for you, that you need some extra assistance, that you need guidance on. But ultimately, you need to be your own advocate and need to be guiding yourself through this. So by doing these things, it's going to really help ensure that you avoid falls, you avoid infection, you get yourself on the road to recovering faster, and you don't have any bumps along the way. So just think about that. Try and have yourself prepared with all of these things. And when I talked about all of this equipment, just understand that typically Medicare and even these managed Medicare plans really only typically cover like a walker, wheelchair, hospital bed. Everything else is out of pocket. So and what I'm going to be doing too is I have an equipment store on my website, which links you up to Amazon. You literally can go in there and I have my top 10 recommendations for the things, like the things that we just talked about: bedside commode, shower chair, grabber, ice pack, pill box, all these things to just help ensure that your recovery goes as smoothly as possible. So thanks for listening along, guys. I hope that was helpful. And if you need any help in the meantime, you're looking for some in-person or some virtual services, reach out to us today. You can give me a call, shoot me an email, and we'll see what we can do for you. Thanks for chatting.